Hi, my name is Low Min Jie. I'm a final year medical student in the University of Malaya. The topic of my presentation is audit on screening of delirium in geriatric inpatients. Delirium is an acute confusional state characterized by disturbances in attention, awareness, and cognition, often due to an organic cause such as an underlying medical condition, drugs, or toxins. It is prevalent and it carries a high risk of adverse outcomes in elderly inpatients, including prolonged hospital stay, increased risk of long-term cognitive and functional impairment, institutionalization, and mortality. As many as 60% of cases of delirium are underdiagnosed. For a few possible reasons, delirium is often overlooked by the doctors, and usage of screening tools in this population is lacking. Early detection and diagnosis of delirium is important to reduce serious implications and improve patient outcome. Therefore, screening is a key strategy to detect delirium early and to minimize delay in management. We conducted an audit to study the frequency of delirium screening, as well as documentation of delirium diagnosis in clinical records among elderly inpatients in the geriatric unit of the University Hospital. In our study, patients aged 65 and above who were admitted to the geriatric ward of UMMC were included in this study. We collected data through clinical documentation, including demographic information like age, gender, and whether the patient stays in a nursing home or their own home, comorbidities including diabetes, stroke, ischemic heart disease, atrial fibrillation, falls, and dementia, cognitive function using the mini mental state examination, and interventions received in the ward, including the use of urinary catheter, nasogastric tube, and physical restraint. All patients were screened for delirium with the My4AT on admission. This is done by the nursing staff. We also studied whether delirium picked up on screening in these patients were actually documented in clinical records. A little bit about the My4AT. My4AT stands for the Malaysian 4AT. The 4AT itself is an internationally recognized bedside tool to screen for delirium. It was designed to be simple for day-to-day clinical practice and require minimal training. It contains 4 items which are alertness, whether the patient is alert, mildly sleepy, or clearly abnormal. The AMT4, which is the abbreviated mental test 4, in which 4 questions were asked to the patient, including their age, date of birth, place, and current year, and to see whether they are able to get all 4 questions correct. Attention, which is to count the months of the year backwards, and acute changes or fluctuation in the patient's mental function. In the Malaysian version, we modified the attention item to suit our local cultural setting. Instead of asking the patients to count the months of the year backwards, we asked the patients to count backwards from 20 to see whether they are able to count up to 7 or more correctly. Generally, a higher score means that the patient is more likely to have delirium. Our study took place over a duration of 3 weeks, during which 68 patients were admitted and 64 were screened for delirium. So among the 64 patients included, 34 patients were found to have delirium on screening, which is 53.1%. Among the delirium group, 47.1% were not documented to have delirium on clinical notes by our physicians. Looking at risk factors, these are the patient data we compared between the delirium and non-delirium group. The average age of our patient is 78 years. Our results found that dementia and use of urinary catheter is significantly associated with delirium. Other than that, we also see a trend towards higher risk of delirium in other interventions that patients receive, such as physical restraint and enteral feeding, as well as patients coming from nursing homes and those with a background of stroke, although these did not reach statistical significance slightly because of the small sample size of our study. The mini mental state examination was done in 43 patients, which is 67.2% of our patients. And we found that patients with delirium performed poorer on cognitive assessment than patients without delirium, with a median score of 3 versus 18. Delirium was prevalent in our setting at 53.1%. This percentage is higher compared to an earlier study done in our hospital, as well as studies done within our regions such as in Thailand and Singapore. This could be in part due to our highly specific population. We studied elderly patients admitted to the geriatric ward, and they are usually frail and independent on activities of daily living. Whereas most studies were based on elderly patients in general medical wards. Other than that, the use of My4AT, which allows the assessor to score untestable patients, also contributed to an increase in the delirium diagnosis. Our study found that 47.1% of patients with delirium were not documented in clinical notes. Looking at previous studies that looked at the frequency of delirium documentation, they also reported varying results ranging from 7 to as high as 44%. So like with poor detection, poor documentation of diagnosis of delirium can also lead to undertreatment. With validated screening tools in place, documentation of delirium is just as important so that we can recognize this condition and physicians can properly manage the patient. What could cause such a disparity between screened and documented delirium? It could be explained by number one, the fluctuating nature of delirium. Patient presentation can change over time. It could be subtle when the patient is seen by the physician compared to when the screening was done. But more importantly, we need to improve communication and cross-check between the use of delirium screening tools and the physician's clinical judgment so that we can fully utilize these screening tools to help improve the diagnosis of delirium. This can be achieved by providing proper training for healthcare providers and develop guidelines or protocols to support healthcare providers who are assessing these patients and to support the accurate documentation of delirium. In conclusion, delirium is prevalent among elderly patients in our study using the My4AT screening tool. However, only half of the diagnosis was documented in clinical records. Therefore, subsequent studies and initiatives should pertain to evaluate disparities between screened and documented delirium. Thank you.